All right, everyone, good evening and welcome to Licensure Reform Strategy and the Coalition for Modernizing Dental Licensure webinar. My name is Craig and I currently serve as the president of ASDA.
Hi, everyone. My name is Roopali and I'm currently serving as the immediate past president. Thank you so much for joining us.
So tonight we're going to be discussing a little bit more about what ASDA has done as far as licensure reform goes, but we're also going to dive into this new coalition that you might be curious about. While we're going through the presentation, feel free to ask questions on the control panel on your screen, and we will address all questions at the end of tonight's webinar.
So to begin, there are a few objectives that we hope to accomplish throughout the webinar tonight and in the information that we present to you. We hope that you learn a bit more about why the Coalition for Modernizing Dental Licensure was formed and to understand the goals of the coalition better.
And then we'll go ahead and talk about ASDA's licensure reform strategy and how that aligns with the coalition licensure reform strategy. And then we'll learn about what the coalition has done since it was formed last year and what we plan to accomplish throughout the rest of this year.
So in order to provide you with some background and context as to why this topic is so important, many of you may know that in order to obtain a dental license in this country, there are three big tasks that have to be accomplished. The first is to graduate from a COTA accredited school. The second is to pass your national board examinations. And the third is to either pass a single encounter patient-based clinical exam to complete a 1-year general practice residency or some sort of PGY1 program, to complete an OSCE or objective structured clinical examination, or to complete a portfolio as offered in California. So in today's webinar, we'll be focusing on this third piece, which is passing a single encounter patient-based clinical examination or alternatives to this in order to obtain a dental license. So it's important to understand why the single encounter patient-based examination needs to be eliminated. Many of you may know that as the current examination stands, it is not reflective of the broad skills or the scope of current practice for a dentist and the knowledge that is needed in order to be successful in dental practice. Additionally, it also poses ethical challenges for students and dental schools as they attempt to recruit patients that fit a specific type of criteria in the exam. Another issue that is presented in the dental licensure realm is the issue of portability. So not only do we think about the initial license or the examinations that we have to take to obtain a license, but we also have to consider seasoned dentists or those practitioners who may be considering moving throughout their career. So as you may know, most states actually require graduates to take a very specific examination. In order to obtain a new license, this practice can actually be quite burdensome on the practitioner. So to give you a better scope, here is a very colorful map that highlights state by state the examinations that are accepted or the pathways to licensure that are accepted. And many of those examinations are administered by a number of testing agencies. So in order to obtain a new license, many times practitioners have to take a new clinical examination and complete tasks that are unfortunately burdensome on the practitioner. So what has been done so far to address the issues of initial licensure as well as portability? So the American Dental Association and the American Dental Education Association, along with our association, have been working on this for a number of years. And later on in the webinar, Craig will dive a little bit deeper into the history of licensure reform. But to provide you with a brief background, we had a joint task force for a number of years, which ultimately formed TARP, also known as the Task Force on Assessment of Readiness for Practice. And this past year in 2018, a report of the task force was released, and the biggest call to action was to create a coalition. So this coalition was launched in October of 2018. And as you can see in the image, all three associations leaders signed on to join forces in order to ensure that the licensure reform process was actually being implemented. So the overall mission of the coalition is to ensure patient safety, increase the access to care for patients, and to promote professional mobility by modernizing not only the initial dental licensure process, but also to ensure that we are decreasing the boundaries in mobility for dental portability. In order to accomplish this mission, we have two very simple but lofty goals. The first is to eliminate the single encounter procedure-based patient examinations, and ideally to replace these with clinical assessments that actually have stronger validity and reliability and address many of the ethical issues that are challenged or posed in the current examination. And Craig will actually dive a little bit further into what those are. And the second goal is to increase initial licensure portability to ensure that we have professional mobility and, more importantly, to improve access to care for our future patients. So I'm excited now to turn it over to Craig to dive a little bit deeper into the history of our licensure reform strategies and how that aligns with the coalition, as well as coalition updates that we have for you.
Great, thank you, Roopali. So the history of dental licensure really began in the late 1800s when there was this creation of professional dental licensure standards. But the exam as we know it today was really formed in the late 1920s when the National Board of Dental Examiners developed the exam, which is very similar to the 5 clinical exams that students still take today. But it wasn't until 1991 that one of the deans at Rutgers School of Dental Medicine released this statement and said that these examinations using human subjects are now absolutely inappropriate. And ever since then, and really ever since the exam came out, ASDA and all of these associations have all kind of pushed for change a little bit, but there really hasn't been some sort of cohesive, solid goal and any really tangible motion towards eliminating the live patient exam. But this is truly a hot button issue today, and ASDA has joined forces with the American Dental Association and the American Dental Education Association to push for change specifically within the past few years. So ADA and ADEA developed separate task forces in 2015, which met in 2016, 2017, and eventually turned into this TARP, which was the Joint Task Force on the Assessment for Readiness for Practice. And before Roopali and I, great leaders of ASDA such as Drs. Christian Piers, Andrew Wells, Adrian Lewis, Sohaib Solomon, and Aaron Henderson all served on these coalitions almost in a liaison role to truly make sure that the dental student voice was heard and that we were going to continue for pushing for the elimination of the live patient exam. And these task forces kind of culminated when they created this call to action that Roopali mentioned earlier, which was signed by the 3 founding members of the Coalition for Modernizing Dental Licensure in October of 2018. Just for some reference there, a task force is really a meeting of just a few associations or organizations to accomplish a goal, whereas a coalition allows other associations and other stakeholders to take part in the coalition's goals and advancing the mission of the coalition. 2016 was a big year for ASDA and licensure. We published our white paper, which is an evidence-based paper based on years of research, which really serves as the foundation for our association's licensure reform argument. And it's available for download on ASDA's website. Also in 2016, ASDA released our new L1 policy, which was first passed by the Board of Trustees as an interim L1 policy because they just felt so strongly that our policy needed to be made a little bit more clear, a little bit more black and white, so there wasn't a lot of gray area and questions when we went to speak to our stakeholders. And then it was eventually adopted by the House of Delegates and now stands as ASDA policy and really helps people like Roopali and I, but also students that are interested in approaching licensure at the state level to talk to stakeholders and really talk about what the issues are with the exam as well as what our ideal exam is. So ASDA would like to see the elimination of human subjects in a live clinical testing scenario. We would like an exam that's psychometrically valid and reliable, and those words are kind of confusing there, but really what that means is the students that should be passing, that have good clinical skills, that should be licensed are passing whatever exam that we have, and the students that are not clinically competent are not passing those exams. We would like an exam that's reflective of the current scope of dental practice, because as you all probably know, right now, the only thing that's required are 2 fillings, a little bit of cleanings, endo on a plastic tooth, and crown prep and bridge prep on a plastic tooth as well. And we know that dentistry is so much more than just those few procedures. And of course, ASDA is pushing for a licensure exam which is universally accepted. I want to highlight these 2 key points here, however, because they really do align with the 2 goals that Roopali mentioned earlier that the coalition is working towards. So one of those goals was the elimination of the live patient exam, and that lines up perfectly with L1's policy to not have human subjects in a live clinical testing scenario. And two, that portability piece that Roopali spoke about, that's covered in our policy where we want an exam that is universally accepted. So ASDA's policy goes farther than just saying, here's what's wrong with the exam, this is what we want. ASDA actually proposes an ideal licensure exam. So this exam would be a three-part exam. The first part would be the mannequin-based kinesthetic assessment. The second portion would be a non-patient-based OSCE, which is similar to the way that Canada licenses dentists. And then the third part of that would be the submission of a portfolio of comprehensive patient care, which is similar to the California portfolio model that's already used. And I want to highlight these 2 points here of our policy because ADEA is already working on forming the Compendium of Clinical Competencies, which is a really fancy word for portfolio. And then the American Dental Association is working on putting together an OSCE, which will be available for pilot for the class of 2020 and will be available for the class of 2021 to take as a possible pathway to licensure, which is very exciting. So over the course of the last several years, specifically since 2016 and the adoption of the licensure white paper, we've had some real strides in our grassroots advocacy within our own association. In Colorado, past President Christian Pierce opened up the door to all pathways to licensure. So whether that be an OSCE, portfolio, PGY1, or one of the 5 clinical exams, that's one of the pathways to licensure. In Iowa, past District 8 trustee Sean O'Neill led students in engaging stakeholders to approach the legislature in order to form some sort of alternative to the live patient exam. In California, students at the University of Pacific teamed up with faculty members to develop a portfolio exam for California. And then most recently in Oregon, students at Oregon Health Science University got together with stakeholders, approached the legislature in order to open up non-patient-based examinations in that state as well, which is all very exciting. So before we dive into how the coalition plans to approach this issue, I kind of want to talk about how ASDA has been approaching this issue over the years. And it really is through grassroots advocacy, which you'll see in the middle of the screen there. First, we start off with identifying target states and states that are open to change. We kind of think of it as like, what is a good climate for change? States where the State Dental Association, all the dental schools in that state, and possibly even the State Dental Board are all on board for trying to change the licensure process in that state to a non-patient-based exam. From there, students work with state dental associations and other stakeholders to kind of put together their licensure strategy in a grassroots sort of effort. And then they finally go on to engage policymakers once their strategy is all together. And those policymakers are usually the state dental boards, which control each state's Dental Practice Act, or it might be through legislation itself in the state houses to actually make these policies law and make the change happen. And you'll see a lot of similarities between ASDA's licensure reform strategy and the coalition's reform strategy. First, identify those target states with favorable climates for change. 2, create state-level coalitions that involve dental students, dental schools, as well as the state dental associations, and then engaging the decision makers and the policymakers at the state level to make our vision and what we're advocating for the actual law of the state. So a lot of people have been asking since this coalition has been formed, what are you guys doing with this coalition? And I'm really excited to announce that we've gotten a lot done over the past couple of months already, and we also have some plans for the future. So in October of 2018, that was when the coalition was launched, and Roopali signed on along with the ADA and ADEA onto this coalition. Our executive committee met for the first time in February of 2019 in Chicago, and there we determined our governance structure for the coalition since it was still fairly new, and we determined next steps and our strategy for the year. And then the coalition was publicly launched as well in February of 2019, where dentallicensure.org went live, and all of our stakeholders were invited to join the webinar, which was then held, or will be held, sorry, in May of 2019. And there, all of the organizations that are key stakeholders are invited to learn more about the coalition and are invited to join as coalition members or supporters. This coming summer, we're going to be having another meeting with our executive committee where we're going to determine how we want to run this first coalition meeting with all of our supporters and members in October of 2019, which will also be held in Chicago. So this is the coalition executive committee right now. We have 2 members from the ADA, Dr. Crowley and Dr. Norbo, and Dr. Joe Crowley, the immediate past president of the ADA, is currently serving as the coalition chair. And then from ASDA, we have Roopali, who's serving as the coalition vice chair, and myself. And then from ADEA, we have the former dean of UConn, Dr. McNeil, and the current dean of Rutgers, Dr. Feldman. But the coalition structure that we decided on at our last executive committee meeting would be to have these 2 coalition founding members from each association, as well as 1 public member and 2 members at large. And those members at large are taken from the coalition members that sign on to the coalition. And the difference between coalition members and coalition supporters is that members are those that are going to be actively engaged and kind of on the ground with us and investing resources into accomplishing our mission and 2 goals, whereas coalition supporters support our vision and goals and would just sign on as a supporter of our coalition. So please feel free to check out our website. It was launched this past February, dentallicensure.org. And on there, as new associations and organizations sign on, they will be listed under member organizations, as we have new news and resources and toolkits available for advancing the mission of the coalition. They'll be posted there as well. And you can also contact us through the coalition's email address. So at this time, really thank you so much for joining us tonight. Please do feel free to list any questions in that comment box off to the side. If we're not able to address your question tonight, whether that be for the lack of time or needing to type a response out, please do feel free to email us and we'll follow up with questions afterwards as well.
Yeah, we wanted to ensure that we left ample time for you all, and we wanted to ensure that we addressed any issues or concerns that you guys had. So we did receive a question of if these slides would be made available to you all, and they actually will be sent to everyone here who is attending, as well as they will be put online on our website. And it typically takes about a week for all of this information to be made public.
So another one of the questions that we have is, based on the previous slide, some states accept multiple forms of licensure. So that's a very good question. Roopali showed that slide earlier with all the different colors. I kind of like to think of it as like a patchwork quilt of dental licensure, because every single state dental board determines the pathways to licensure in that state. So several states decide to take all 5 licensure exams: CDCA, CETA, CERTA, REB, and credits. Some of the other states might choose to take 1 or 2 of those clinical exams. Colorado, as an example, takes all forms of licensure. So whether that be one of the 5 clinical exams, PGY1, portfolio, or OSCE. So every single state decides which ones they want, and that kind of is the reason why every state is almost a different color, because there's so many combinations of exams taken.
And I think it's important to note, as I mentioned, that because dental licensure is so complex, a lot of our strategy has to be done state by state and at that grassroots level, so that we're engaging the various stakeholders who are there and can specifically address any discrepancies in the way the licensure process is done in that state. So we received another question here.
So the next question is, when would the soonest we could see a change in the single patient encounter type of examination? I think what's really exciting is we're already starting to see change. So as we mentioned before with those 4 states, there's already several states in the US where you can become licensed without taking a clinical exam. But that's not universal yet, and that's what we're really fighting for, is to ensure that students are clinically competent through some sort of third-party evaluation, but that exam is also universal, so that you can practice in more than just like those 8 states. So.
And just to provide even a little bit more information, many states, for example, as Craig mentioned, the 2 pathways that, number 1, the ADA and ADEA are specifically working on, many states have already decided to join on and pilot, for example, the dental licensure OSCE, in order to see if they would want to accept that in their state, which is really exciting that the pilot will be occurring very soon. So there are states that are already expressing interest in wanting this change, and that's why, as part of the coalition, we've actually identified several target states that we want to work with. And what we're hoping for is to essentially create a domino effect as states decide to join on and make change with the alternatives that are being presented. We hope that that will create a bigger effect throughout neighboring states and then, of course, all across the country.
So I think my prediction there would be we're going to see a lot of movement within the next 2 years. So once ADA pilots their OSCE for the graduating class of 2020, I think we'll see some states jump on board. And then once other states jump on board and accept it for the class of 2021, we'll see other states sign on to that as well.
We received another question here regarding California and the portfolio model and how that change occurred. So just to let you know, the portfolio model in California was actually piloted with the University of the Pacific students as well as faculty. So it actually originally did not have the portfolio model. California accepts the REB exam, which is the Western Regional Board examination. And the way they did that was because there are many dental schools in the state of California, they were able to actually work together and actually with organized dentistry. So their state association was interested in helping them put this together. And so the way it works in any sort of state when you're trying to develop changes to actually include the opinions and thoughts of multiple stakeholders. And so the way that change occurred was first actually developing what a portfolio would look like, what would be included in sort of the assessments in clinic that we already have, perhaps some of the competencies that we need towards graduation or the competencies that we need that CODA sets for us in our dental schools. And they work together to create a model specifically for those competencies. Although it's not as popular of an option in California currently, it is something, for example, that ADEA is using in their compendium of clinical competency assessments. And just to kind of elaborate a little bit more on what that looks like, because that's a lot of words put together, it's essentially trying to standardize or calibrate the competencies that we already have to take in dental school and clinic. For example, in your clinical experience, you may have to complete a class 2, class 3 fixed competency. And so that type of assessment would need a standardized rubric in order to ensure that there's calibration across all schools in how they're assessing competency among their students. And then they would ideally get that all together, all that information, the schools would, and send it to a third party to evaluate you in your assessment all across your clinical career. So it's not just a single encounter with a patient, but rather you're looking at multiple encounters and how you've progressed throughout your clinical experience in school.
So what is a good way to explain the issues of licensure to incoming dental students? I think this is a really great question because it is often very intimidating to talk to dental students once they get into dental school. But then by the time we start learning about this licensure process, most people are in their 3rd, 4th year and kind of on their way out. So I think a really great place to get started is on ASDA's website. We have a section for advocacy with talking points for dental licensure, as well as on our YouTube channel of Dr. Colleen Green, past president, gives a really great 3-minute video on dental licensure and almost like a surface level introduction. So I think by using the resources on the ASDA website along with that video, maybe during like a freshman welcome week, that's a great way to introduce students to that issue.
Many schools host specific programming as well to ensure that they're introducing advocacy efforts as well as licensure in a more user-friendly way. Many students believe as D1s, you've worked so hard to get to dental school and all of a sudden you're being bombarded with a lot of information, but we actually want to increase awareness and engagement early on to ensure that our efforts are being continued throughout our years in dental school. As you know, our membership turns over so quickly and our leadership turns over so quickly. So we want to ensure that we're engaging incoming D1s. And as Craig mentioned, there are a lot of resources on the ASDA website that provide tangible ways for you to get involved or to get incoming students involved. So we received another question. Recommendations for current dental students and how they can make an impact with their school's administration and their state's dental association. Craig, do you want to
Yeah, so just kind of as an example, Roopali and I have been working on dental licensure reform within Pennsylvania, which is a little bit slower. But we started by setting up a meeting with our new dean here at Penn, kind of talking to him about why we're so passionate about the issue and breaking down the various aspects of ASDA's L1 policy to him to kind of gauge his thoughts on supporting our efforts. So, and then after that, we approached people at the State Dental Association, mostly the president and now the immediate past president of the Pennsylvania Dental Association, who were very open to the idea of licensure reform within the state. But what's really nice about utilizing your administration as well as your state dental association is they often know people on the state dental board, and they have a much vaster network than we do. So it's really great to just be able to sit down and have conversations with them. And I think you'll find that a lot of them are more approachable. I think it's just about finding those 1 or 2 key individuals that are really receptive to student feedback and just sitting down and grabbing coffee or dinner with them and talking about licensure.
I think the best way also to approach this is not anytime you're trying to work with your school administration is that it's not an us versus them issue. This issue of licensure actually affects everyone and all the stakeholders involved, whether it's how your school runs specific clinical examinations. It might affect your faculty, it might affect your clinic time, and honestly your patients as well. I think it's important first to educate yourself on the issue fully and to use a lot of the states, for example, that Craig mentioned throughout the webinar as examples of success stories and how perhaps you can cater that to your state. I think it's just about being honest and open and genuine about wanting change for the better in order to ensure that your school is also supporting the best ways to assess their future dentists and the people that they're graduating. And then from there, once you've kind of had those initial conversations and you've built those relationships, it's easier to speak to representatives from state dental associations and then state dental boards from there.
And I think what's really important to note about that as well, especially since we've now formed this coalition with ADEA and ADA, is keep in mind that all of your deans are members of ADEA, and they're kind of supposed to follow what ADEA's policy is. So by them signing onto this coalition with us, they're going to be more willing to work with you because of this new coalition, as well as the American Dental Association. All state dental associations are components of the larger ADA. So having this as ADA and ADEA policy also means that state dental associations and deans should be more receptive and supportive.
We're also really excited that in the coalition, we are going to be creating toolkits and even more additional resources for grassroots advocacy efforts that you would be able to access and be able to take back to your own home state and cater based on where your state is in the climate of change. So there is another question of what organizations are invited to join the coalition. So as Craig mentioned, the overall structure of the coalition, as well as coalition members and supporters, many different organizations are being asked to join the efforts. Many of them are also national organizations, and those include other members of organized dentistry, specialty groups, as well as dental hygiene, who have been very supportive of change, as this also affects their licensure process. And supporters are also other organizations or associations that have been supportive of change in order to protect patients. So that's a big reason why we are looking for a public member to also serve on the coalition's executive committee to ensure that we're getting a broader look at dental licensure and not necessarily just so introspective with dental organizations. But many organizations as well as dental schools have expressed interest in being a part of this. And as ASDA chapters, you're actually already a part of it because of the national efforts that we have done. And so any resources that we create would actually be made available to you as chapter leaders and members. But we're excited that we are rolling out the applications for joining the coalition as either a member or supporter. And the executive committee will be reviewing those and targeting our specific tasks and what our efforts are going to be based on the association's strengths.
Great, so the next question is very common. How do I respond to stakeholders that believe that the curriculum integrated model addresses concerns that we highlighted with licensure? So for those of you that don't know, the curriculum integrated format for ADEX or for CDCA is a model that rolled out at Buffalo. So it's also commonly called the Buffalo SIF model. And with this, it's really just ADEX, but it's administered at multiple points throughout the year. So that whole argument of ethics and of recruiting patients that are not patients of record and not providing that follow-up care and all of that high stress single encounter exam, all of that is still there with the curriculum integrated format. They just send examiners multiple times per year. So it's all of the issues with ADEX, just multiple times per year. So all of the arguments for ethics that we use for the regular single encounter live patient exam can all be used for the Buffalo SIF model.
And many stakeholders believe that because it's offered throughout multiple times and that you may be performing procedures on patients of record who have these procedures already treatment planned. Unfortunately, in theory, that may be true, but in practice, in many schools, that is still not the case, that there still needs to be a recruitment of patients, which can lead to students having issues with how they're going to complete the task or in how they're going to provide financial incentive to those patients to remain part of the examination. So unfortunately, student extortion as well as patient recruitment can still be a major concern in this type of model.
And still performing procedures that wouldn't necessarily be done in the dental school, like on really small ideal lesions, and still paying your patients. Like those issues don't disappear just because the exam is administered throughout the year.
Okay, we received another question.
I think we already answered that question.
Did we answer this? Yes. We want to make sure that we're addressing all of your questions and concerns. Okay, so we received a question of how can we get involved at the state level to help the coalition's goals. That is a great question, and we want to ensure that we get everyone involved who's interested in helping in this grassroots effort. So as we'd mentioned before in the webinar, there are a lot of stakeholders who are involved in creating change for licensure. And so the first thing is, as I mentioned, is really educating yourself on the issue of licensure and working with either your chapter legislative liaison to come up with a plan of action specifically for your state. The second is to have genuine and honest conversations with your school administration. As you gain support and from your administration and faculty, you can actually use that as leverage to speak to your state dental associations or state dental boards thereafter. The world of dentistry is very connected and small, and so many of your schools, administrations, and faculties are actually directly involved in organized dentistry or perhaps have connections to people who are involved in their state dental associations or state dental boards. And so the first thing is really getting everyone on the same page. And as you know, we'd mentioned that there have been states in the past who have had ASDA students or leaders be able to make change because they've actually listened to all of the opinions and thoughts of the stakeholders who are involved. Then from there, once you gain the support of your state dental associations, one of the best routes is actually talking to your state dental boards. That way you're ensuring that you're respecting the opinions and thoughts of the state dental boards, who are actually the people who want to ensure the best for your state and the protection of the public. And from there, one of the best ways was, as we've said, as a gold example, was Colorado. And in Colorado, they've actually come to accept all of the clinical licensing examinations, as well as other alternative pathways to licensure. So I think it's really great once you get all of these people together and have these conversations to actually use specific states as an example. Where has this worked and why has it worked? And it's not necessarily about you as the student in finishing this examination, but it's also about the best for your patients and to ensure that we're actually being licensed in a way that assesses our competency and doesn't put our patients at risk. So making it and ensuring that we're highlighting more about what the patients are going through is actually the best way to get involved. So we have some questions about how want to make sure that we answer all of your questions here. So I'm going to try to see if we've addressed any of all of these so far. And as we mentioned before, if there are questions that we aren't able to get to tonight, we encourage you to email us. Our emails are listed here, and we want to ensure that we get back to you as soon as we can with any questions that we aren't able to address.
The next question is, when will the Coalition Communications Toolkit become available? Resources will probably be developed starting at the executive committee meeting this coming summer, and we will continue to form resources throughout the summer until the end of the year, especially as we approach that fall meeting with all of our coalition members and supporters. So definitely take a look at dentallicensure.org probably late in the summer, and hopefully we'll have some resources up by then.
And as we develop them and finalize them, they will actually continue to be made available. And we would be happy to know whenever those do arise that we can inform our membership of those resources. So how can we expect to stay updated on coalition efforts in the future? So that's a great question. As we mentioned, we typically use our website as the best way to provide resources for you all, as well as news and updates. There will be emails that are sent to you guys as part of our advocacy briefs of any advocacy initiatives or efforts that have been successful. And if something like this in the webinar was useful, we would be happy to host another webinar to talk a bit more about what the coalition is doing. But the biggest way will definitely be dentallicensure.org. There we will have all of the most up-to-date information, the various organizations or associations who have decided to join. As Craig mentioned, we continue to develop resources that will be made available on that website. So we encourage you to look at that, as well as if you have any individual questions, to stay connected with us. Right. So if there was anything that we weren't able to get to tonight, please feel free to email us, and we would be happy to respond to your questions.
All right, have a good night, everyone. Thank you so much for joining our webinar tonight, and definitely stay updated on dentallicensure.org as well as through the ASDA website, and we look forward to connecting with you later. Have a good night.
Have a good night.